Water's inclusion in a list of gout-friendly foods requires justification since it technically isn't food. However, its crucial role in uric acid metabolism and gout prevention makes it inseparable from dietary management. Hydration status directly affects uric acid concentrations in blood and urine, influencing both crystal formation risk and kidney excretion efficiency. The mechanism by which water affects uric acid management centers on concentration and volume. Uric acid solubility in blood and urine depends partly on the volume of fluid in which it's dissolved. Adequate hydration maintains higher fluid volumes, keeping uric acid concentrations lower and reducing the likelihood that concentrations will reach levels where crystals form. Kidney function, central to uric acid excretion, depends critically on adequate hydration. The kidneys filter approximately 150 to 200 liters of blood daily, concentrating waste products into about 1 to 2 liters of urine. Insufficient hydration reduces filtration efficiency and urine volume, concentrating uric acid and other wastes to potentially harmful levels. Dehydration has been identified as a trigger for gout attacks in numerous studies. When body water decreases, whether from inadequate intake, excessive sweating, vomiting, or diarrhea, uric acid concentrations rise. This concentration increase can push uric acid above solubility thresholds, promoting crystal formation that triggers acute attacks. The kidneys regulate uric acid excretion through filtration and selective reabsorption. Approximately 90% of filtered uric acid is reabsorbed, with only 10% ultimately excreted. This balance can shift with hydration status, with adequate fluids supporting higher excretion rates. Chronic dehydration may promote greater reabsorption, worsening hyperuricemia over time. Recommended water intake varies by individual factors including body size, activity level, climate, and health conditions. General guidelines suggest approximately 8 to 12 cups, 64 to 96 ounces, daily for most adults, with higher needs during hot weather or physical activity. For gout patients, erring toward the higher end of recommendations provides additional protection. Urine color serves as a practical hydration indicator. Pale yellow urine suggests adequate hydration, while dark yellow or amber indicates insufficient fluid intake. Aiming for light-colored urine throughout the day ensures hydration adequate for optimal kidney function and uric acid management. The timing of water intake matters less than total daily consumption, though spreading intake throughout the day maintains more consistent hydration. Drinking water with meals supports digestion and contributes to daily totals. Keeping water readily available encourages consistent consumption. Plain water represents the optimal hydration source, providing fluid without calories, sugars, or potentially problematic additives. While other beverages contribute to hydration, many contain components that affect gout risk. Sugary drinks and fruit juices contain fructose that increases uric acid production, negating hydration benefits. Coffee and tea, despite containing caffeine, still provide net hydration. Previous concerns that caffeinated beverages cause dehydration have been largely disproven. Both coffee and tea can contribute to daily fluid intake, with some research even suggesting coffee may reduce gout risk through mechanisms beyond hydration. Alcohol's diuretic effect promotes dehydration while also increasing uric acid production through multiple mechanisms. Beer contains purines from yeast and grains, directly increasing uric acid load. All alcohol types impair kidney uric acid excretion. For gout management, alcohol avoidance or strict moderation is recommended, and when consumed, additional water intake becomes even more critical. Sparkling water provides variation while maintaining hydration benefits. The carbonation doesn't affect hydration quality, and unsweetened sparkling water offers all benefits of still water with different sensory experience. This variety can help individuals who find plain water unpalatable maintain adequate intake. Infused waters, created by adding fruits, vegetables, or herbs to water, enhance flavor without significant calories or problematic ingredients. Cucumber, citrus, berries, mint, or ginger infusions make water more appealing while adding subtle flavors and trace nutrients. This approach supports increased consumption for those struggling with plain water. Electrolyte considerations become important during prolonged exercise or heat exposure when sweat losses include sodium and potassium along with water. Sports drinks provide electrolytes, but often contain excessive sugars. For most daily hydration, plain water suffices, with electrolytes adequately replaced through food. During intense or prolonged activity, electrolyte-containing beverages may be appropriate. Individual water needs vary significantly. People with larger body mass, those living in hot climates, and physically active individuals require more water than average guidelines suggest. Conversely, certain medical conditions may require fluid restriction. Most gout patients benefit from generous hydration, but those with concurrent heart or kidney disease should follow healthcare provider guidance. Water quality affects both palatability and safety. Municipal water supplies in developed countries generally meet safety standards, though taste varies with mineral content and treatment methods. Filtration can improve taste if this encourages greater consumption. Bottled water provides convenience, but at environmental and financial costs. Hydration needs increase during illness, particularly with fever, vomiting, or diarrhea. These conditions deplete body water rapidly and can trigger gout attacks through concentration effects. Maintaining or even increasing water intake during illness helps prevent dehydration-triggered attacks and supports recovery. The relationship between hydration and medication effectiveness matters for gout patients taking allopurinol, colchicine, or other drugs. Adequate hydration supports drug distribution, metabolism, and excretion. Some medications, particularly colchicine, can affect kidney function, making hydration even more critical for protecting renal health. Water intake before, during, and after alcohol consumption provides harm reduction for those who choose to drink despite recommendations for avoidance or moderation. While water cannot neutralize alcohol's effects on uric acid production and excretion, maintaining hydration reduces the concentration effects that exacerbate alcohol's impact. Every alcoholic beverage should be accompanied by water. Temperature preferences for water don't significantly affect hydration quality. Some people prefer cold water, finding it more refreshing and easier to consume in larger quantities. Others prefer room temperature or even warm water. The optimal temperature is whichever encourages the most consistent intake. Habitual behaviors support consistent hydration. Keeping a water bottle visible on the desk, drinking a glass with each meal, or setting phone reminders can establish patterns that ensure adequate intake. For individuals unused to drinking substantial water, gradually increasing intake over weeks makes the adjustment more comfortable. The environmental impact of bottled water consumption versus reusable bottles and tap water deserves consideration. Single-use plastic bottles contribute significantly to waste. Using refillable bottles with filtered tap water provides equivalent hydration with reduced environmental footprint and lower cost. Hard water, containing higher mineral concentrations including calcium and magnesium, may actually provide slight nutritional benefits compared to very soft water. These minerals contribute to daily intake, though not in quantities that substantially affect requirements. Water hardness primarily affects taste and appliance scaling rather than health impacts for most people. Overhydration, while rare, can occur with excessive water intake overwhelming kidney capacity to excrete fluid. This is primarily a concern during endurance events or with certain medical conditions. For typical daily life, even generous water intake unlikely approaches dangerous levels. Listening to thirst signals and aiming for pale urine color provides safe guidance. Children and elderly individuals face higher dehydration risk due to reduced thirst sensitivity or inability to access water independently. Gout is less common in children but does occur, and hydration principles apply equally. Elderly gout patients may need reminders or assistance ensuring adequate intake. Medications affecting fluid balance, including diuretics commonly prescribed for hypertension, require attention to hydration. While diuretics increase urine output, Adequate water intake prevents excessive volume depletion. Patients on diuretics should discuss appropriate fluid intake with healthcare providers. The simplicity of water as an intervention makes it accessible to all regardless of income, education, or cooking skills. Unlike dietary interventions requiring food purchases, preparation knowledge, or culinary facilities, water requires only access to safe drinking water. This universality makes hydration one of the most equitable gout management strategies. Seasonal variations in fluid needs mean summer requires increased attention to hydration. Higher temperatures and increased sweating raise water requirements. Air conditioning reduces some heat stress, but can create dry environments promoting fluid loss. Year-round hydration awareness prevents seasonal attack triggers. Travel presents hydration challenges through disrupted routines, limited bathroom access, and sometimes questionable water safety. Carrying refillable bottles, purchasing bottled water when needed, and consciously maintaining intake despite routine disruption helps prevent travel-triggered attacks. Water's role extends beyond direct uric acid effects to supporting overall health. Adequate hydration supports cognitive function, physical performance, temperature regulation, and numerous other physiological processes. The comprehensive benefits mean that hydration improvements support overall well-being alongside gout management. Monitoring hydration through urine color, thirst, and even tracking intake apps helps maintain awareness. While obsessive tracking isn't necessary, periodic assessment ensures adequacy. For individuals with recurrent gout attacks, keeping a hydration log may reveal patterns connecting inadequate intake to attack timing. The cost-effectiveness of water as an intervention cannot be overstated. Tap water in areas with safe supplies costs essentially nothing. Even bottled water represents minimal expense compared to medications, healthcare visits, or productivity losses from gout attacks. Investing effort in consistent hydration provides exceptional return. Cultural practices around beverage consumption sometimes emphasize drinks other than water. In some traditions, tea, coffee, or other beverages predominate. While these contribute to hydration, balancing them with plain water ensures adequate fluid intake without excessive caffeine or other components. The psychological aspect of self-care through hydration shouldn't be dismissed. Consciously attending to hydration needs creates a practice of health awareness. This mindfulness may extend to other health behaviors, creating positive cascading effects beyond the direct hydration benefits. Educational efforts should emphasize hydration's importance as consistently as dietary modification. Healthcare providers, patient education materials, and support groups should address water intake with the same attention given to food choices. The simplicity of the intervention makes it an ideal focus for consistent messaging. In conclusion, water represents the most fundamental and accessible intervention for gout management. While technically not a food, its essential role in uric acid metabolism, kidney function, and overall health makes it inseparable from dietary management. Adequate hydration provides benefits immediately, continuously, and with zero risks or side effects. For anyone managing gout, consistent appropriate water intake should be the first and most reliable daily practice.